This is Dr. Oscar from Advent Health Sebring. I am an internal medicine physician, and today I will be discussing one of the major factors contributing to heart failure in about 12 to 17% of the affected adults, and that is the substance-induced cardiomyopathy. It is approximated to be 8.4 deaths per 100,000 population in a previous report. Today, we are discussing the trends in the substance-induced cardiomyopathy-related mortality among older adults in the United States from a span of 22 years, and we have explored CDC Wonder database to achieve these results. As we all know that substance-induced cardiomyopathy can be frequently seen in male individuals that are 75 years and older, and the most frequent cause is alcoholic cardiomyopathy, which results from the long-term alcoholic abuse, while many drugs can also cause drug-induced cardiotoxicity. Most notably are the drugs like cyclophosphamide, anthracyclines, which are the chemotherapeutic drugs, and also cocaine abuse is one of the leading cardiovascular disease risk factors that can cause myocardial infarction and congestive heart failure. So we have clumped all these substance-induced cardiomyopathy into one ICD-10 code diagnosis, and we use the CDC Wonder database for epidemiological research to investigate the data collected from the death certificates from all over the United States. Our inclusion criteria includes incident of substance-induced cardiomyopathy in older adults who are dying from this disease between the years 1999 to up to 2020. We use the ICD-10 codes of 42.6, 42.7, and 42.9 in the CDC Wonder database. We use the multiple cause of death public use registry to find the incidences of substance-induced cardiomyopathy, which is listed as a leading contributing factor or the primary cause of death in these cases, and have calculated the mortality rates per 10,000 people for both unadjusted and age-adjusted data by using the Joint Point Regression Program, which is a software provided by National Cancer Institute to determine annual percentage change and its associated 95% confidence interval in age-adjusted mortality rates. There were a total of 473,000 deaths in the senior population who were 75 years of age and older than that during the years of 1999 up to 2020. A total of 45% deaths occurred in the medical facilities, while another 24% occurred in the nursing homes and long-term facilities, while 4% happened in the hospice centers, and another 26% transpired at home. The overall patterns of age-adjusted mortality rates, it was quite high back in 1999 with the rate of around 14.5%. By the year 2020, it had dropped to 7.7. And from the years 1999 to 2001, the actual age-adjusted mortality rates showed an overall increase with an annual percentage change of 1.57, but it was followed by a subsequent fall from the year 2001 to 2020 with an annual percent change of 3.58. Negative. Male gender, non-Hispanic, Black, or African American population was highly affected by the incidence of mortality in this disease. Region-wise, South was most likely affected from this disease in the early 90s and the late 90s and the early 2000s, but later on in the later 2020s, it was the Midwest region that was most affected with substance-induced cardiomyopathy. Metropolitan areas are highly affected than non-metropolitan areas, and the top 90th percentile of states involved are Delaware, Maryland, Florida, Pennsylvania, and New Jersey. Thank you very much.